Okay, I opened today with how cancer metastasizes, some of the similarities between fungus and cancer. Tape this show, you're going to need it later. Dr. Simon Yu from St. Louis is here. Why do anti-parasitic and antifungal medicines target cancer cells? He's written a book, Blow Up in Medicine, okay, accidental blow up in medicine. Do you know dogs sniff mold? Oh, those same dogs sniff cancer. Why is that? Are they one and the same? And finally, integrative dentist, Dr. Carey O'Reilly, all the way from San Diego, is going to teach us today. I open with root canals. He uses lasers for these things. All that and more on this Know the Cause. Let's get started.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate. And you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
Wow, that was 2002. Dr. Beverly Hunt, Dr. Dave Holland helped me with his book, The Germ That Causes Cancer, 17 years ago. This was my hypothesis, and I'll explain it to you in a minute. It was a big book. It wasn't bound properly. We probably printed 5,000 of them off, and they sold quickly. Now we have a little short version of The Germ That Causes Cancer, an easy read for people. But I'll tell you why I do that. A few years ago, I read this. Scientists provide explanation for how cancer spreads. We call that metastasis. This Dr. John Poelek says, although we know a vast amount about cancer, how cancer cells become metastatic still remains a mystery. See, I don't know how you can know a vast amount about something and not know from whence it came or how it spreads. But these are smart people. He's out at Yale University, and I'm sure he's a great guy. This was in 2008, okay? 5 years later, in the year 2013, this is Dr. Lazava, and she and I wrote some emails back and forth. Really a good person. 5 years later, Yale University researchers continue. Our results provide the first proof in humans that metastasis of cancer can occur when a white blood cell and a cancer cell fuse and form a genetic hybrid. Now, I want to show you the cover of this book, The Germ That Causes Cancer. Remember the flux capacitor? You know, Back to the Future, the flux capacitor in that DeLorean. This was my flux capacitor on the cover of this book. There you see fungal DNA and human DNA merging to form a hybrid, which is a lump, a hybrid DNA or cancer down here at the bottom. Okay? Silly, I know, says my next graphic. But what if cancer cells were sometimes fungal cells, as I believe they are? After all, they're really similar. And let me show you what I mean by that. This is a graphic that I have showed to many doctors and many in the lay audience. And it's an important graphic so you better understand that cancer and fungus are really similar. Number one, they each thrive in a sac formation. Number two, they metabolize nutrients without oxygen. They grow without oxygen. They each generate a poison called lactic acid. Each depends on us for sustenance, proliferation, and reproduction. Each thrive in the presence of sugar and die in the absence of sugar or carbohydrates. Each emit volatile organic compounds. Dogs that sniff out mold also sniff out cancer because they both have VOCs, and that's what dogs sniff. And finally, we now know that Lamisil and thiabendazole and Sporanox both respond to antifungal medications. Isn't that fascinating? I mean, they share those. So folks, when you have a sac fungus that's growing in a sac to protect itself from our white blood cells eating it up, it grows in a sac and it reproduces, and through the months and years it gets bigger and bigger and bigger, and a cancer tumor. How does a doctor know? And the quick answer is a biopsy. We've all seen studies of doctors taking lung tissue, sending it to a lab, and they say, yep, that's cancer. Why? It's a cancer lab. Why don't you send half of it to a fungus lab and see if that lump isn't a sac fungus. They just don't do that. They're not there yet. I think 15, 20 years, obviously, if Know the Cause has any say in it, it'll be sooner. They're not there yet. They don't know these core, yeah, cancer and fungus might grow in tumor, but you know the difference. Really? How is it then that those 24 patients, 27 patients in 2013 with diagnosed lung cancer ended up getting well on antifungal medicines, proving this wasn't cancer, this was fungus growing in their lungs? These Yale doctors are brilliant, but I disagree that they have discovered the cause of cancer metastasis. I believe their discovery is much greater than the cause of why cancer spreads. Serendipitously, if my genetic fusion cancer hypothesis is accurate, they have actually discovered the cause of cancer. I'll never forget Milton White. He was a doctor in Michigan hospital. We got on an airplane, flew back and met him. His wife had died of breast cancer, and in tears, he's in his white lab coat, probably in his 70s, he's crying. His wife, before she died, grabbed his arm and said, "Milty, you're a smart man. Figure out this disease." And he just wept. He was an amazing man. And before he died, some years later, he wrote this in a medical journal. He told me he had figured out the cause of cancer. Cancer is neither the result of a virus nor the consequence of an inherited gene defect. Cancer is a hybrid. It is due to a plant conidia, these spores, derived from an ascomycete or sac strain of fungus. That was in 1996. I learned much from Dr. Milton White before he died. I learned from Dr. A.V. Costantini. I learned from so many giants what I today believe to be the cause of cancer. If I had cancer anywhere in my body, I'd get it cultured for fungus. Go ahead and send some of the biopsy to cancer labs, but it's very important that you send some of it off to a mycology lab. Mycology is the study of fungus. Hope this helps. Here we go. Okay, I'm joined today by a man I have so much respect for. I read his book, Accidental Cure, a few years ago. He writes books you can't put down. He has recently written a book and sent it to me, and I got him on the phone and I said, "Would you do me a favor, please come out and be on our show?" Then a research paper comes to my desk, Anti-Parasitic and Antifungal Medications for Targeting Cancer Cells. What? Here's a physician that knows that. Thank you, Dr. Yu, for coming in and being on the show. Your reputation really preceded you. I had been to some of your meetings, and what you're doing is amazing. How long did it take your brain to figure out that medical training, there was maybe a little void, that we were looking at an ear, nose, and throat, or a brain, and not the whole body? You are looking at people as a whole body. That's different from most physicians.
Yes.
Yeah. When did you first pick that up?
You know, I started looking for alternative therapy after about 8-9 years of practicing internal medicine. And to put it together, I was studying acupuncture meridian system by by dentist, Dr. Douglas Cook from Wisconsin.
Yep.
And I realized there's no separation between dental and the rest of the body. And connecting the dots, so many what we call incurable medical symptoms actually originate from the dental-related problem.
And so you must have a litany of questions that you ask the patient, right, the first visit. Tell me about, or you look in their mouth, oh no, you've got 2 crowns, you've got 4 root canals, and that might spell disaster, but more importantly, it gives you a clue as to the root cause of the person's maybe stomach or brain problems.
Right, most people don't even remember what kind of dental work they have done to them.
Right.
So I pick up the signal through the meridian testing. I call this an acupuncture meridian assessment, or called AMA, and there's a dental signature comes up. Now I look at the dental x-ray, and I can tell them what kind of problem they have. A lot of times they don't remember what has been done to them.
How many of the patients you see, and I know you see a lot of them, do you feel have an infectious agent, and not so much a bacteria as maybe parasitic or maybe fungal infection? What percentage of the patients that come in may have that?
at least 80–90% of the people who already went through the regular doctors and major institutions don't know what's going on. It's there.
Yeah, and you're like a doctor who peels an onion. You look for this. Tell me, are we? I don't have it here with me, but are we in trouble with our cell phones, with our Wi-Fi in our living rooms? Are you concerned about electromagnetic fields?
Yeah, it's not only the problem, but it's the real problem is why only some few percent of the people are really so sensitive to the electromagnetic field, and those people already have root canals, they have crowns, the metals, and they do have a heavy metal problem. They're even super sensitive to EMF.
So heavy metals.
Yeah.
I mean, a typical doctor might chelate those out, but you look so much deeper. I mean, you look at the person's home, you look at the person's, mouth. You do things. The doctors in the old folks used to tell their patients, stick your tongue out, look at the teeth. They don't do that anymore, but here's a doctor that does. In the book, Accidental Blow-Up in Medicine, fabulous book. About half of this book is teaching you, oh, you mean this is liver? And this tooth is so bad. Learn this. This is your life. This is your health. Your doctor doesn't know this. The second part of the book, and thank you, references some of my work in the meetings we've had together in the mold, mildew, and fungus. Take the final minute and talk to people about parasites.
I see parasite and fungus as together. There's an ecosystem of the same complex that support each other. If you treat parasite, then the fungal problem shows up. Or if you treat fungal problem, then I see the parasite problem more clearly. So you have to treat them both. So I go through the cycle. Anti-parasite medication and anti-fungal medication go through the multiple cycle to reduce your total body burden for the infection. When you do that, your viral load goes down, your bacterial load goes down.
Because these mycotoxins themselves infect the immune system.
Oh, yeah, absolutely, yeah.
It's such a unique practice. Folks, it's kind of in the middle of the U.S. This is St. Louis. If you go there, plan on spending a week and letting him look over you. What, I'm trying to think, do you have to lose? You're running from doctor to doctor. Here's a doctor that thinks outside of the box. Thank you for the book, Accidental Blow-Up in Medicine, and thank you for who you are.
Thank you.
Very good to see you. Friends, I read the other day on the World Wide Web that they now have a pill, a pharmaceutical prescription pill, coming out for loneliness. They'll stop at nothing. From womb to tomb, their goal might be different than mine. Their goal is to drug everyone in America from womb to tomb, right? That sells drugs. I understand. I'm a capitalist. You probably are too. What my goal is to help you better understand why the fear, why the narcolepsy, why the low blood sugar, why the lump, is this cancer? My goal is to do that because with this education, you are then empowered. There's power in knowledge. Okay, what I want to teach today is what we're finding from dog studies. These are brilliant animals. I think dogs and cats and all animals go far beyond our understanding sometimes. And here's a case in point. What causes cancer, narcolepsy, where you fall asleep all of a sudden, migraine headaches, low blood sugar, seizures, epilepsy, fear and stress? What causes all of those? We don't know. Or do we? Next graphic. 6 things that dogs can sniff out. That's what they are. From cancer to migraines and even seizures, dogs can give us a heads up about a range of human diseases. I think that's true. But wait, there's more, as the old ads go. It's fascinating to me that a dog can very accurately sniff out cancer. Very accurately, okay? Case in point. Published in the Washington Post in 2004, according to scientist Paul Wagner, the interim director of the Auburn University's Canine and Detection Research Institute, a dog's senses of smell is at least 1,000 times more sensitive than a human's. Their reliability depends on that training, whatever training they have. Under the right conditions and right training, dogs are able to be 90% accurate in detecting substances like mold. Wait, Did he say substances like mold? What's like mold? Let's go to the next graphic. In 2014, a 39-year-old woman has breast cancer diagnosed by her puppy. The story was priceless. This puppy kept, just gravitating to her breast. And she went in for a mammogram, and lo and behold, that breast had a lump in it, and it was cancerous. Dogs are trained to sniff out volatile organic compounds. They're called VOCs. And it just so happens that both fungi and cancer tumors emit volatile organic compounds. Do you see where I'm going with this segment? Are we confusing people? I really don't mean to. But according to this scientist, dogs are really good at going in your home and sniffing out where you have a leak and there's mold in your home. And sometimes companies will charge you $100 to have dogs come in. Aha, behind the bathroom, the tub must have overflowed one time. Behind the bathtub, there's mold growing under there. Good for you, puppy dog. But look at what's published on WebMD, a pharmaceutical website here in the US. A new study, which is published in the European Respiratory Journal, found that 4 trained dogs, 2 German Shepherds, an Australian Shepherd, and a Labrador Retriever, correctly identified cancer. Wait a minute, that doesn't say mold. Correctly identified cancer in 71 of 100 samples from lung cancer patients. They also ruled out cancer in 372 out of 400 samples that were known not to have cancer, giving them a very low rate of false positives, about 7%. False positives on a mammogram are much higher than that. I'm just saying, here's where the confusion is. You see, folks, the people who train those puppies to sniff mold don't know anything about cancer. And the people who study cancer are amazed that these dogs can walk right up to you and with 71% accuracy sniff out a cancer in your body. I'm thinking if I go through a cancer screening, I might hire 10 dogs to come to my house and sniff me, right? It's just amazing, but these cancer doctors know nothing about mold, okay? In 2016, a toenail antifungal drug, Sporanox, was repurposed and approved as a cancer drug. I hope by now you're going, wow. But all Sporanox does is kill fungus, yet it's helping many cancer patients. A coincidence, perhaps? Or are fungal infections being diagnosed as cancer? I implore you to always, folks, a smart patient gets the work done. I know, doctor, but I have lived in mold for a long time, and you've had me on antibiotics for a long time. These are mycotoxins. I drank way too much alcohol when I was in my 20s. Could this lump in my breast, my brain, my prostate, my kneecap, could these be fungus? To which the doctor will have to tell you the truth, I don't know. In 2014, I and a couple of physicians wrote this paper. It's tiny, but it was published in Oncology News. Fungi and their mycotoxins, the poisons they make, an underappreciated role in cancers. Wow. I've been talking about this for 40 years. All I'm here to tell you is this. When you have a lump, a bump, a cancer in your body, just rule out that it isn't something much, much less likely to prove fatal. It could be a fungus. Folks, joining me right now is a friend I made 4 or 5 years ago. His name is Carey O'Reilly. He's a dentist, Dr. Carey O'Reilly. He's from San Diego, but don't let that stop you. He graduated from USC Medical School, dental school back in 1984. Welcome aboard, Dr. O'Reilly. Thank you so much for joining us.
Thanks, Doug. Thanks for having me. It's great to be here.
I'm going to cut to the chase because every medical meeting, and we met at a medical meeting there in San Diego, every medical meeting I go to, these words seem to prompt the ire in so many holistic doctors and dentists. They are root canal. Can you expound on that and what you do differently as a biological dentist or a holistic dentist than what another dentist might do?
Sure, Doug. Thanks. Yeah, the root canal is a big issue, controversy in dentistry. Patients don't want them, but the reality is there's no other way to save infected teeth once a tooth gets infected. So you go to your dentist, you go to your endodontist, who's just a specialist, and they treat the root canal, get as much bacteria out of the tooth as possible, refill or pack the tooth to prevent those bacteria from coming back. The problem is that research has shown that not all the bacteria is removed during root canal therapy. There's no way to actually remove it all with traditional means or traditional instruments that are being used. So even there's research in the Journal of Endodontists that shows that maybe 30, maybe 40% of the tooth that's infected is untreated and untouched during root canal therapy. That's not good news from my point of view, because there's bacteria left behind. That's the controversy. So root canals have gotten a bad name, even in the whole, especially in the holistic or integrative circles of doctors and patients.
But what do you do then? In other words, if that's the problem, how do you resolve it? How do you, as somebody who looks at the whole body being out of her eye when you keep becoming infected, what do you see or do differently?
Yes, this has been a big issue for me personally, because I want my patients to have bacteria-free results. I hate bacteria in the mouth. It causes inflammation and problems elsewhere.
Right.
So my focus is to remove all the bacteria, get this tooth treated, get that treated. So what I've done is I bought an erbium laser. It's a laser that actually promotes healing in the body, lowers inflammation, and removes all the bacteria from the tooth, from the root canal system in the tooth. And it does that by streaming different solutions through the root canal system: antibacterial solutions, a chelator, ozone. I use ozone in my protocol as well, because ozone definitely helps and it definitely works to lower inflammation.
Are you left with, do you use supplements? I mean, after the patient is done, you've had them on a few antibiotics, this laser and ozonation and everything you do you think there's valid research to confirm that maybe some immune building supplements for a period of time afterward help?
Absolutely. It makes a difference. You need a strong immune system to heal, flat out. So if your immune system is compromised, you're not going to heal as well.
Yeah.
And so whatever you can do to build up that immune system, whether it's nutritional, you can use so many different products to do that, and you might need to talk to a nutritionist or a naturopath. But we give our patients some support in that way, like nutritionally, supplemental treatments, homeopathics, for instance. I can inject things that also help locally with the healing process. And the laser helps with that too, with healing.
You're so far beyond the regular dentist. You said the D word, diet, supplements, laser. Congratulations. I wanted to have you back on by popular demand. I wanted you to know that. We've had a lot of requests through the years to have you back on. Thank you for joining me today.
Thanks, Doug. I appreciate that.
My Holistic Dentist with an H. myholisticdentist.com. Thank you, Dr. O'Reilly.
You're very welcome, Doug.
I don't think it's coincidental at all that anti-worm, anti-parasite, and antifungal medicines target cancer cells. Are they one and the same? Thank you, Dr. Simon Yu, Accidental Blow-Up in Medicine. You're going to love his book. Thank you also to integrative dentist, Dr. Carey O'Reilly in San Diego. Folks, I keep learning and learning and learning. Why are there so many similarities between that sac fungus and that cancer tumor? God bless you. I'll see you next time. Tell a friend about Know the Cause. Thanks for watching.